name is Dr. David Rapaport. I'm a board-certified plastic surgeon here in Manhattan, and I've been in practice for about 25 years. The most common form of hair loss that I see is androgenic hair loss, as we call it, male pattern baldness, so we see that a lot. In women, hair loss is a little bit different, and it's a little bit erratic and more generalized on the head. With males, as probably anybody watching this video knows, the classic pattern is varieties of temporal recession, thinning in the frontal area, as well as thinning in the crown, and when it all runs together, you have that classic horseshoe pattern of hair loss. When I first heard about low-level laser therapy for hair loss, I thought it was a gimmick. I thought it didn't work. And then I did a little bit of research online, and what I found was surprising. I found that there are a myriad of peer-reviewed scientific publications that demonstrate the efficacy of low-level laser therapy in both men and women for hair loss. So that's what led to my adoption of the treatment, and in fact I do use it myself. So the ideal time for someone to come see me for hair loss is early, because aside from taking care of hair transplantation, which is moving hair from the back of the head to the front, if you come early, we can partner together to slow down the rate of hair loss, delay the need for hair transplantation, and help you keep the native hair that you do want to keep. And we have really great techniques to do that, including the Capillus cap. Capillus works by providing an ideal array of low-level laser light, which stimulates hair follicle cells and promotes hair health and hair growth. It's not harmful to anything, it's not carcinogenic, it doesn't have any negative side effects, and so the earlier you start, the better. One thing that's important to understand is once you can see the scalp through someone's hair, that means they've already lost 50% of the hair. Capillus is truly the Cadillac of hair restoration caps. It has the ideal array of lights, the best density, the best strength. It's just the best product. Their support is also excellent. I find that the Capillus cap is completely comfortable to wear. It fits well on my head. It's really no big deal. The advantage of Capillus over other non-surgical options is that it's completely safe and it's effective. So with any treatment for hair loss, it's a slow process. So if you start using Capillus cap every day starting today, you're going to start to see results in about 3 or 4 months. And that's typically true for any treatments you're doing to help promote hair health, because it relates to the cycle of the hair follicle itself. It takes time for the input to affect the cells and for that effect to affect the growth in the hair shaft. Using a Capillus cap is extremely easy. You just put it on, you push the on button, and you do whatever you're doing for 6 minutes, and then it beeps and it's done and you can put it away. A charge lasts for several treatments. It's easy to do. You can have your cap on while you're preparing a meal or while you're working on the computer or watching TV. It's just no problem. Having a good head of hair is important to a lot of men and women, and achieving that goal can certainly change someone's life, mainly by restoring their own self-confidence. That's really the most important thing about everything I do as a plastic surgeon. It's all about how you feel on the inside, but so many of us are looking at how we present ourselves, and the better we present ourselves to others, the better we feel on the inside, the more confidence we have, the happier we are to deal with our day. I am a 58-year-old board-certified plastic surgeon, and I can say unequivocally that I am a proud user of the Capillus cap, and I recommend the Capillus cap to my patients and friends who are interested in improving their hair loss situation.